Okay. So, hello everyone. Elrigu namaskara. The KRSSDI initiative, Doc Skills program, we all know it, one of the very well sought after program of our division of RSSDI. And today we have a very special guest who will be our speaker, Dr. Bharat Saboo. Hello, Dr. Bharat. Welcome to Karnataka RSSDI.
Thank you.
Technically, and of course, shortly we'll see you in physically also. Bharat has been a director at Prayas Diabetes Center, Indore, and he is trained in data science or precision medicine from Edinburgh University. That's why I was choosing him, because he is well known to be a good speaker all over the country, and especially this topic of artificial intelligence. If I keep reading his CV, it will be a too long one. He has a lot of accolades. Winner of the USV JPF Diabetes Technology Award in 2022, winner of Journal of Endocrinology Travel Grant for the year 2022, and winner of RSSDI USV Award for Innovation in Diabetes Care at RSSDI 2021. And he is also winner of Upcoming Researchers in Diabetes Award at DiaCare Conference 2021. A good friend of mine, and we all enjoyed the DiabetesIndia 2023, where Indore hosted it, and it was a very successful program. And to know about this initiative, Dr. Bharat and all the other listeners, this has been started during the last year's tenure of Dr. Suman in able guidance, assistance, and motivation from Pankaj Srivastav, whom we call as Dr. Pankaj Srivastav, the founder of WWTC, who has more than 30 years of experience in the pharma field. Not only that, he is a trainer for many of the companies for their soft skills program. So other panelists, I think Dr. M.A. Shekhar, the Vice Chancellor of Adi Chunchangiry University, Mandya, he will join us in a bit of time. And our past chairman, Dr. Suman, welcome to you. Welcome, Dr. Vijay. And I would like to say that Dr. Bharat will talk on this all-important topic of artificial intelligence and diabetes. Where are we heading? Are we losing the natural instincts, Bharat, and going only artificial way? I don't know. And to moderate from here on, I would like request Mr. Pankaj to take over.
Thank you, Dr. Manohar. In fact, you have done most of my work already. So first of all, on behalf of Winning Ways Training Consultancy as well as KRSSDI, I extend a very warm welcome to all the participants as well as to our panelists for this session. And I'm really grateful to Dr. Bharat as well as to all the panelists that they have actually spared their valuable time, right? As Dr. Manohar has said, DocSkill is an initiative which was started last year. And the sole purpose of this initiative was that, soft skill is something which is not being taught in the medical curriculum. So this was something which I always wanted to plow back, having seen the interactions of doctor-patients, having interacted with the doctors. So when I retired, I thought that whatever little I have learned, let me plow back to the pharma professionals as well as even to the doctors also, because in my family, my son-in-law is a doctor, and the same thing. I keep on telling him also that, look, when you are interacting with the patients, because he is a surgeon, you have got to be very, very careful. So with that idea, we started this last year under the stewardship of Dr. Suman. And I must say that now it has almost completed, say 1 year, 4 months, and it is still running. We are only trying to widen the scope of this because it all started with the soft skill sessions. And now we are trying to slightly widen the scope by incorporating some of the topics which are also not being discussed, like as we were discussing that we have included, say, healthcare insurance or cyber security. And this is a pure scientific topic and a very interesting one. I would only like to set, Dr. Manohar, with your permission, as a preamble, I just want to say 2-3 things, because artificial intelligence is not new, right? Though I must say that with the advent of COVID, COVID has actually hastened the adoption of digital media by the entire pharma industry as well as by doctors also, right? And we also know that the disease burden of diabetes has been increasing phenomenally. I mean, I have been for last 30 years, I have been, interacting with the patients, and I've seen disease burden has gone up significantly. And now the best part is that with the digital adoption, with the artificial intelligence, with the machine learning, I think we can have a better access to the diabetic patients. And if you see, I mean, in what way this is going to be helpful, first of all, a lot of data, of course, we are having, seeing the type of number of patients, whichever doctors they have been seeing. And again, with the advent of electronic medical records, I mean, we have got access to a lot of data, right? And what artificial intelligence does, artificial intelligence actually gets lots and lots of data. They processes, they create the algorithm. And with the help of that algorithm, it helps us to predict a much better and a much faster and a much accurate way of various diseases, about complications, etc. So, I mean, I think now with this advent of artificial intelligence and machine learning into the therapeutic arena also, we are going to have a much faster and accurate predictive model. And this is also going to be extremely helpful in research work, right? Because in research also, you need a large amount of data, and that is also what is being facilitated. I mean, I know Dr. Say, for instance, Dr. V. Mohan was the first doctor in India, whereby, I mean, he actually did a lot of research on the predictive models of retinopathy, for instance, with the help of the artificial intelligence. And now we know through genomic data, a lot of predictive models, we can actually work it out, right? So I know that this is a very interesting topic, and we are all very eager to actually hear Dr. Bharat, because I mean, I know if you Google it right now, which was also a part of the artificial intelligence only, simply type artificial intelligence and it will throw so much data. So with this, I know there's enormous amount of data, and we are all very eager to listen with rapt attention. So with this, I will simply hand over to Dr. Bharat, because your introduction has already been done by Dr. Manohar. I can only say, when I saw your CV, and as he says, as Dr. Manohar has said, the type of accolades which you've acquired, I mean, having worked in US and in all these places, and specifically you have done some projects on artificial intelligence. Being a doctor, I mean, mostly engineers and all these people, IT professionals, they are into all this. But being a doctor, you have done so much into this. So we are really eager to listen to you, sir. Over to you.
Thank you, Pankajji. Thank you. First of all, thanks Karnataka RSSDI for the kind invite. And I must thank my dear friend Manohar for inviting me here, and all the esteemed panelists, Dr. Vijay Kumar, Dr. Somana, Dr. Pankaj, and even Dr. M.S. Sekhar and Dr. Sekhar Y, who are going to join us a little later. Also, a thank to the delegate who have joined. Pankaj sir was very right in setting the tempo up, and this is the field where we have artificial intelligence now with us, and this actually has done wonders to us. I hope my slides are visible to you.
Yes. Yes.
And my pointer as well. So we will be diving through this topic in next 30 minutes or so. It is a huge topic, but I will try to cover it up. The topic which has been assigned is artificial intelligence and diabetes. And Pankajji was rightly telling us that artificial intelligence involves a lot of data. And actually, this is the data which actually creates problems for some, and it is a boon for many. So regarding my conflict of interest, there is no conflict of interest regarding this talk with mine. And this is what Dr. Manohar was asking me. If you want second opinion, I will ask my computer. This is actually when patient comes to us and he asks doctor that, can I have a second opinion? Now doctor have the ability to say that if you want a second opinion, I will ask my computer, you don't go anywhere, and we will have a second opinion right over here sitting in my OPD. You just sit on the couch and we can have it. So this is future of us? Let us see. Now, AI, which is artificial intelligence, is already seen as the most disruptive technology. The successful app publishers are generally more bullish about the newer technology. And you can clearly see the publications regarding artificial intelligence is already topping the list, and most disruptive technology in digital health within the next 5 years would be artificial intelligence, and next to be followed would be remote monitoring and assistance. Third would be wearable, and fourth would be IoT. So these all four are actually a part of artificial intelligence. We have subdivided it, but all things relate to artificial intelligence. The fuel for this remote monitoring, wearable, and IoT comes from artificial intelligence only. So let us see what is this artificial intelligence, because we are intelligent enough, but we need to see what is this artificial intelligence. In the field of computer, it is associated with the concept of machines who are thinking like humans. When machine starts thinking like humans to perform tasks which we perform, like learning, problem solving, planning, reasoning, and identifying the patterns. This line is most important. Pattern identification, when a machine is able to do it, we call it as artificial intelligence. So let us subdivide all these three things which Pankaj was talking about. Artificial intelligence, machine learning, and deep learning. Now, artificial intelligence, we all know, is a technique that enables computer to mimic human intelligence, including the pattern recognition. It involves and includes machine learning. Machine learning, what it is? It is a subset of artificial intelligence where machine is learning, where we enable the machine to improve a task with experience, and it includes deep learning. What is deep learning? It is a subset of machine learning where the neural networks, like the neural networks we have in our brain, that permit a machine to train itself to perform a task. So there is a training, then which is deep learning, then machine learning is actually improving at the training, and artificial intelligence is the ultimate thing which we are talking about. Now, to see it here, this is actually an artificial intelligence model. It looks too complex, but it is very easy. Machine learning involves deep learning, I have told you, and predictive analysis. In speech, what we do, we use speech to text, text to speech. This is again a part of artificial intelligence. In vision, we have machine vision and image recognition, which many of us are using. It is again a part of artificial intelligence. Then the language processing, neural language processing, NLP. It is for classification of the data, translation of the language which is there, and extracting the data, good data out of it. Then there are expert systems, planning and optimization, and robotics. So these are the subcomponents, subdivisions of artificial intelligence where the artificial intelligence can be used. Now, we all are surrounded by it, you and me, because when if I am speaking, my iPhone must be hearing this and Siri must be recording everything. We have Google and OK Google with us. We have Alexa at home, and we are already surrounded by artificial intelligence. And whenever we are talking something, our machines are getting smarter by learning how we are talking, what we are talking, and what we would be talking next. Now, everybody is talking about this thing, artificial intelligence. So diabetes and artificial intelligence, if you search for publications in past 30 years, you can just see the curve. The number of published article in Google Scholar has gone like anything. This rocket has started climbing. It is actually flooded with greatest data, which is there for diabetes and artificial intelligence. And you can see this data that artificial intelligence is growing by a 45.3% CAGR. A CAGR of 45.3%. Would you believe it, for next coming 4 or 5 years, where this industry would be heading, the artificial intelligence in healthcare market? Can you please mute yourself? Tim, can you please mute Mr. Dinesh Kamath?
Hello.
Thank you. So an AI system is able to do, first of all, reasoning. It can make inference using data. Secondly, it can process the language which is there, which is ability to read and understand and respond in human languages. Planning, to plan and act autonomously and flexibly to construct a sequence of action. And then machine learning, where the machine learns automatically through experiences itself. It can play a triple play actually in whole healthcare, not only diabetes. Cost impact is there. It reduces the customer care executive need, reduces the cost of population health management, reduces the medical loss ratio by straight through processing. It impacts business also, because then business can create distinctive healthcare solution. We can increase savings and enhance the member patient's experience, because we can increase the number of patients who are experiencing this, and number of members who are interacting with it. It can again accurately diagnose genetic condition. We can personalize the patient care. We can automate the process such as sales and pricing of healthcare plan, collate and analyze healthcare data, and efficiently engage with member or patient. So, Miss Dr. Robot will see you now would be the next level of artificial intelligence. So actually, we are into a world where everything and anything can happen. So digital health. Now let us see what is digital health. Digital health product actually consists of wearable sensors, which we all are wearing, which communicate with wireless communication, and a smartphone, which everyone is having these days, and a software which processes the information. So this digital ecosystem of data-driven tools, it links people with diabetes and their care team. Suppose your patient is wearing a watch and you are having a smartphone. So the data from the watch goes to the smartphone of patient, and from his smartphone comes to your smartphone. So you have all his data with you. You can use it in 4 ways where AI and machine learning are making an impact. There are deep learning algorithms which can diagnose diabetes scan with 90% accuracy. Then deep learning algorithm which can detect heart arrhythmias in ECG signal, which are a better judge or better accuracy than cardiologists, and AI powered control center, which is at Johns Hopkins, which allowed staff to assign ED patient to inpatient bed 30% faster. That is a software which is AI powered at Johns Hopkins, which actually gauges the vitals and it quickly assigns the patient to inpatient bed. And payer that such as Athena, which are in US, they use 350 machine learning model and for security and to combat fraud for the insurance. Now, this is a typical patient which will look like in future, and many of them are like this today. Headband, earring, skin patches, belt, body sensor, and socks. They will be having everything. And the data which would be generated would be heart rate, respiration, blood pressure, temperature, SpO2, the cardiac stress, activity, calorie burn, fitness, heart rate variability, even the sleep, glucose, abnormal movement, and change in weight. So this all data constitutes the big data. All of the data which we collect here constitute the big data. It comes from wearable device, publicly available data, electronic health record, you and me, which we are using, social online data from digital communities. It will go to the digital therapeutic platform with embedded healthcare intelligence. Then a support system would be there, where there would be human, which would be coach, machine, chatbot, and process. And then patient-centered outcomes would be taken out of it. These outcomes would be learned by machine again. Machine learning will again come into play based on the responses from patient. And then again, the algorithm will adopt to it and change the level of support. And then again, the next patient-centered outcome would be generated. So the explosion of data is invaluable, but human intelligence, we all know we are not able to capitulate on this much data. Even if a patient comes with this much data to our clinic, we will ask him to come tomorrow. The artificial intelligence, what is the foundation of it? First, let's say there is a problem. We want to rule out CAD in a diabetic with doubtful symptoms and normal EKG. So we want to rule it out. What we do, we actually take data from history, physical examination, demographic, family history, genetics, biochemical testing, normal EKG, subtle changes, wearable sensors, food diary we take, outcome of person with similar medical, physical, genetic, ethnic background. We always say that prevalence of this is this, the complication rate is this, and this. It is all based on what? It is based on medical, physical, genetic, ethnic background. This would be done by AI. Then AI will compute this. There would be a computing program which enable to process this big data. And then human would be there, which would teach the program. Look, there can be CAD, there cannot be CAD, but it will depend on these parameters. Now, AI program is asked to generate the pattern for each outcome based on this data. It says CAD present, it says CAD absent. Now, next level, after the foundation, what happens? Machine learning comes. The problem is same to rule out CAD in diabetic with doubtful symptom and normal EKG. Now the AI program, which has already learned here, the human has trained him. It actually predicts the condition based on recognition of pattern, the past patterns of big data. Then again, there would be a human in this stage, which will give feedback and validate the program. He will say, yes, AI, you are right, or no, AI, you are wrong. So here, the human was making a decision. In the next stage, human was validating the decision taken by AI, and AI again fine tunes itself. CAD present and CAD absent. And now what happens? There is no human. We are not involved. The problem comes and the AI gives solution, because now AI know how we will behave, how we will react, how we will respond. So that is how we will be substituted and AI will take over once AI learns all the things which we are doing. Now, what are the application in diabetes? AI attributes which can be used are image processing, pattern recognition and prediction, as I've told you, extracting meaningful information from surrogate markers. Now, in diabetes, we can use it in hypoglycemia prediction and management, insulin management, personalized OHA recommendation, personalized diet, patient education and counseling, target organ assessment and prevention of target organ damage. The automated detection of diabetic retinopathy we all are doing. This is actually a heat map which is generated by AI on different severe level of DR. And we all are using this in a clinic. It has high sensitivity and specificity in detecting DR. So it is feasible to carry out AI-based DR screening in OPD of a community hospital. You don't require an ophthalmologist. And 2 FDA-approved diabetic retinopathy detection system for non-ophthalmologist use are already available. So we don't need ophthalmologists to evaluate a patient with retinopathy. Now, image processing, better than human vision, because they can involve thermal imaging, tissue density differentiation can be done, the differentiation in tissue density, dynamic change flow detection, image enhancement, and feature extraction. We can do all these things. It is very easy with actually AI. Now, in hypoglycemia, they can predict, prevention, and insight. All these 3 things can be done. And this is actually a line written by a program. Look at this program, and this line is written. I read it out. I see that your sugar is often below target between 12 p.m. and 3 p.m. on Saturdays. This machine is telling that on Saturday, in the afternoon of 12 to 3, you have a hypoglycemia. It is also saying, because it has sensors which are with watch and everything, you might be doing something different at that time. I will keep an eye on the pattern during this time as I get more data, because it is calculating on Saturday, there was 71% time below range, and other days it was 11. So the machine has learned it. It is showing that this period is danger for you. And wow, you are protected from a hypoglycemia. This is a Sugar IQ app by Medtronic. The mobile phone app integrates with Guardian real-time CGM, and it is powered by Watson AI system, which is made by IBM. And it tracks the influence of diet, exercise activity, treatment, time of the day, and location also. It gives detailed trends, hypoglycemia prediction. Look 4 hours before it actually occurs. It requires CGM. It requires twice daily calibration and manual entry from food items. And it directly shares the data with healthcare provider. But it's a boon for many, because it can predict hypoglycemia 4 hours before its occurrence with the help of AI. Now, this is again been possible with pattern recognition and prediction. And this is a FDA cleared technology, which says you clearly see you are expected to experience a low within the next 2 hours. This is just like a meteorological department who is actually giving estimate for the rainfall in next 2 hours. So you are very much there, and you know it that you are going to have a bad hypo or a hypo in next 2 hours. You eat something and you are prevented. Now, AI in hypoglycemia, how it works, it has a threshold alert, and which says that it cannot avoid hypoglycemia after that. So hypo alert occurs at this point of time. You do a carb intake, and the time intake in hypo is this. This is usual. But predictive alert, this is on the threshold, but predictive alerts you before the hypo, at the hypo threshold. So at 7 hours 55 minutes, the 20-minute ahead prediction, it tells the machine that we can have a hypoglycemia, because it is calculating the rate of fall of glucose, and it gives a predictive hypo alert. You eat something and you are through. Closed loop hybrid pump system. This is actually again AI powered. Basal insulin rate adjusted automatically according to glucose level. It determines the correct bolus. It does an intelligent prediction of glucose trends, hypoglycemia alarm, and insulin infusion suspension function. It has having a safe pre-meal insulin dosage determination after manual logging of carb content of the food. You just enter the carb content of the plate, and it actually gives the safe pre-meal insulin dose value. And there is a significant reduction in severe hypoglycemia after this. Now, insulin dose adjustment for patient not on pump, even there we can use this, because glucose reading, insulin administration, meal intake, physical activity, these are the 4 data which we need to enter. The decision support system, it actually personalized insulin bolus calculation is done, adaptive tuning of bolus calculator parameters, and glucose prediction. They all help in doing optimal insulin dosing and smart alarms which can prevent from hypo. Now, this is again a TREMET software, AI-powered digital endocrinologist. It is again US FDA approved. In type 1, it was approved in 2018, and in 2021, type 2 diabetes, it was approved for patients on insulin. So data from CGM, SMBG, and pump is uploaded to a data management system. The advisor pulls the data, analyzes it using the MD Logic software, searching for highs and lows along the specific individual pattern, then produces a full titration recommendation regarding this and optimization of basal rate, carbohydrate ratio, correction factor, and personalized management. And the SCP operating the program can review the recommendation, edit it, and finally share with the patient via email, app, or print. So at this point of time, SCP can see, but when it learns on its own, it has been found non-inferior to endocrinologists for glycemic control and hypoglycemia, and it just takes 20 seconds to generate a recommendation while we take 15 minutes. So it's very fast. Now, AI-enabled precision personalized medicine. This is actually phenomenal thing. Now, clinical-based categories, they are divided based on HbA1c values, 6.5 to 8, 8 to 10, and more than 10. Then integrated data is calculated from all of these subset of patients regarding refined glucose phenotyping, beta cell function, insulin resistance, inflammatory marker, polygenic risk factor, genomic regulation informatics, blood metabolomics, tissue-specific metabolite dynamics, gut microbiota, lifestyle behavior, what are there, and then their categories are subdivided into data-driven categories based on this, and reproducibility, interpretability, and actionability is then assigned. So actually, precision medicine is now on a verge where it can actually transition the way we practice medicine. Now, individual patients respond differently to drug, actually. So the ability to predict which treatment is best for a particular patient is based on a personalized profile, which is created here, data-driven. And personalized prescribing enables selection of right drug and dose. Suppose one person is responding to normal dose, second is responding to lower dose, third is responding to higher dose, and one is not at all responding to the normal dose, whether it is normal dose, lower dose, or high dose, and he is responding to some alternative medication. So you are actually saved from all these problems which arise when we do dosing which is not required and when we do dosing which is suboptimal. Now, again, personal nutrition is the thing where AI will take over. It actually measures personal feature for 800 patients and predicts the personal glycemic response. This is a published data. The data which was collected was for microbiome, blood tests, questionnaires, anthropometrics, and food diary. The personalized nutrition predictor is there, and it designed then personalized diet to lower the glycemic response. The glycemic index in era of personalized medicine become something different. So different subject because they take the same thing which has a glycemic index of say 60, but they will behave differently for different food. So now with personalized medicine and personalized meal planning, glycemic index would be a thing of the past. You can behave differently to mango than I behave. So anthropometric parameter, dietary history, microbiome properties from stool sample, genotyping, and continuous glucose monitoring data of few hundred individuals. They would be fed to a special computer program. It will recognize subtle pattern and it will make algorithm to predict glycemic response. This is the precision medicine. And once computer learns this pattern at community level, it will classify food into good and bad with fecal microbiome sample, anthropometric data, and basic genetic analysis. It will tell us the list, what is good for Bharat and what is good for Manohar. So what is food to one person may be poison to another. We know this, and AI will does help in creating a personalized diet for everyone. Look, I may not respond to banana and I may respond to cookies in a bad manner in terms of glycemic control, but Dr. Manohar may respond to banana in a bad manner and not to cookies in glycemic response. So this all depends on person to person, and that is where AI will come into picture. because AI will extract this data. It will segregate good food for me, bad food for me, and good food and bad food for Dr. Manohar also. So we will both be having a different list of foods which are good for one and good for another. So actually that will help to save us from glycemic excursion out of eating while we are just eating based on the glycemic value which is given by the book. Now, AI again, comprehensive patient education and behavioral intervention is the one thing where it can help wonderfully well. This is a one-drop AI system. It is looking something like this on phone. It forecasts the glucose for next 4 hours. It gives a forecast of the glucose. Look, wonderful machine. It gives a 4-hour forecast, just like the rain forecast. And it tells us a snack time. And when there is a hypo, it tells us a small snack 1 hour before a low can help you keep in range. So you are taking a small snack 1 hour before the low. So you will not have a low actually. It gives you a list, food to choose and food to avoid. So 1.9% is the estimated A1C reduction when people use this one-drop AI system. 20-gram fewer carbs per meal were eaten. 35 minutes of additional activity per week was with the help of pattern recognition and language processing. Now, ECG analysis is again one thing where we can train machines with data, and 11,000 patients, 780 hours of ECG from more than 11,000 patients were fed into in. This is a rhythm study, and it actually gave us the gold standard clinical validation. This is software which is Beat Logic, which is based on AI and deep learning. So it detects beat 99.97%, AFib sensitivity 96%, sinus sensitivity 97%, and VT sensitivity of 97%. Phenomenal. The AI heart health actually is with us. Our Apple Watch tells us, not in India, but other parts of the world, it talks about the AFib, and it gives us a indication, and it tells us that heart has a sign of irregular rhythm suggestive of AFib, and then we can contact our doctor. So this was actually the mortality rate from the electrocardiogram analysis of third NHANES data. 7,000 odd participant risk scoring was done. The machine learning model only required demographic and ECG data. Only these two things. It can then predict 10-year cardiovascular mortality in ambulatory adult with potentially important implications for primary prevention. So it can predict and patient can be saved. It can predict the 10-year cardiovascular mortality based on age, systolic blood pressure, R amplitude, J amplitude, and all these leads actually are taken by it itself. Now, the automated detection of hypertension using physiological signals, a review was done, and this was very recently published in 2021. It was using a cuffless and wireless remote BP. It can be used in hospital intensive care unit to aid the staff to alert the sudden rise in BP of patient immediately and provide accurate treatment. So it is wonderful tool actually. Now, ECG data contains significant predictive information for detection of various cardiac abnormalities like systolic dysfunction, early diagnosis of asymptomatic CAD, diastolic dysfunction, AFib, pulmonary artery hypertension, hypertrophic cardiomyopathy, mitral valve prolapse, and AI applications are also impacting other imaging modalities in cardiology like CT, MRI, and echocardiography. It again offers significant rate of remission for type 2 diabetes compared to standard care. This is from ADA. And type 2 diabetes reversal occurs with twin technology enabled precision nutrition and staging of reversal. This was a retrospective cohort study which was there, and it told us that the change in hemoglobin HbA1c from baseline to 90 days. Look here. Here is baseline, here 90 days of follow-up in patient who remained and adhered to the twin precision nutrition, just like I told you, and actually it worked wonderfully well for these patients. This is again the change in percent of patient with HbA1c 6.5. Look at this. See how it goes up. The person having HbA1c more than 6.5 has gone down. And this is actually again a AI-based model which was published recently, which predicts the progression of diabetic kidney disease using big data machine learning. The machine learns and it tells us that how many of them are going to have a CKD. And this actually shows the improved global outcome KDIGO guideline recommended eGFR and albumin creatinine ratio. And they cannot precisely define and identify patient who will experience rapid kidney failure. So negative predictive value for low risk is 93 and positive predictive value for high risk is 69%. And thus AI may help in prediction and prevention of worsening of DKD. Now, when we combine AI and footwear, it improves the diabetes treatment. This is the future shoe, how it will look like. The real-time data storage pattern recognition. You can see the digital twin model. It would be water resistant. There would be so many sensors, metrics on the foot pressure, temperature, pronation, and foot strike. All this would be measured, calculated, and it would be having a wireless charging. The data would be sent to smartphone via Bluetooth. Then data would be monitored, and then it will process the data, and it will predict the foot ulcer. It will do the wound assessment, and it will suggest for appropriate individualized footwear for the patient. But AI has some downside also, because AI is only good as the data it relies on, because only thing which runs AI is data. The problem with data is there is no data in developing countries. Many of our friends and colleagues are not feeding in the right data into EMR system. The data may sometimes be biased because data obtained mainly from Caucasian population. We are not putting enough data in. The data quality is the issue. GIGO phenomena, which is garbage in equals garbage out. If we put a garbage data, the data which is not useful, the output would be garbage. Data labeling is the issue sometimes. Potential software errors can occur, and intention of vendor again is at stake, because many vendor we have seen, we were selling EMR and now behaving differently because they were high on hype and short on product. Variability in results from different AI system for same outcome, and physician training, acceptance and adoptions become a issue. But it will definitely improve the diabetes care, because data is the king and information is power. Human intelligence needs AI to make sense of huge amount of data provided by technology. AI actually can predict the diabetes by scoring. It can then help in selection of appropriate anti-diabetic treatment, prevention of hypoglycemia, target organ assessment and protection, behavioral modification, quality of life improvement, and cost saving. So AI is going to be with us. And thank you. I just end my talk with this line from Steve Jobs, that technology is the amplifier of our intellect. Thank you.
Thank you, Dr. Bharat. I think in 45 minutes, you have encapsulated so much, and in such a beautiful manner, that such a complex topic, I think every one of us is having a better clarity on this. And just to summarize as to what you have discussed about, I mean, you have started by sharing all of us that what is AI, what is remote monitoring, and then you also explained beautifully what are the various components of AI, like machine learning, and then you went on to tell us what is the deep learning. And of course, then you further told what are the various components of AI, including NLP. And one thing was very striking to my mind when you said that in terms of publication in artificial intelligence, there's almost a CAGR of some 43%, which is huge, I would say. I mean, compounded annual, if the growth is at this rate, you can very well imagine. I mean, I remember very often when I used to select people, I mean, this question I used to ask, how do you see yourself in the next 5 years? And if this question comes to us, I mean, what is going to happen in the next 5 years with regard to, say, diabetes treatment? I mean, the type of shoes what you have shown, I mean, it's going to be a complete changeover. And then you further told about the reasoning, the natural language processing, planning, action. You also shared about triple play, like cost, business, operational inputs, digital health, artificial intelligence foundation, big data. And then you talked about what is the application of artificial intelligence in diabetes, what are the various attributes. And then you talked about insulin dose adjustments with the help of the artificial intelligence, especially in those patients who are not on pump. Artificial powered digital endocrinology, a dream met for type 1 and type 2, you talked about in great length. What I really also liked was when you shared, that different people are responding differently to different food items, where you gave your example of cookies and bananas with that of Dr. Manohar. And it's a fact. I mean, CGMS patches, if you apply, and if suppose somebody is monitoring or having that, food diary, and if you superimpose with this simple method also, you can come to know as to what are the food items which are giving glycemic excursions. And something on the similar lines, this AI is also going to predict, I mean, what are the food items which you can have, what are the food items which you cannot have, very specific to a particular person, because his glycemic variability is very different. So this is going to open up a new vista, in fact, for many persons, for many companies also. Then again, you talked about one drop AI system, where almost with the application of this, I think if I remembered correctly, you said around 1.9% HbA1c, you can reduce it, which is again
Without
phenomenal.
medicine, without
Huh?
medicine,
Without medicine, without
just by
medicine.
substituting the food.
Very, I mean, imagine what it can happen, what it means to a diabetic person, right? Then again, you talked about revisiting ECG analysis, AI heart health, Chang study, and of course, you also talked about Dr. Parmesh and Dr. Joshi's study of twin, which he presented, I think, last year in ADA. So overall, I must say it was very invigorating, very knowledgeable, content, which I'm sure is going to be helpful for all of us. The floor is all open now for any comment, any suggestion from our doctors. How did you like? What did you like? Because I think he encapsulated so much, because it's a very interesting topic. I mean, I suggest for a common person also, this is the future and we cannot survive without this. I mean, I know old people, they adopt, all these technologies a little bit slow, but I say that, look, though I am on the other side, but still I don't foresee I can survive after 5-6 years if I do not adopt and embrace this change. So over to everyone, over to the floor.
Yeah, Bharat, terrific talk. You covered almost all aspects. So sometime down the line, I was thinking whether you are talking or you have enabled something artificial intelligence which is talking to us. I don't think that days are not too far, which I think the computers or the artificial intelligence will be the speakers and also listeners and chairpersons. I don't know. There was a joke like, I don't know if artificial intelligence will replace doctors, but definitely the people, the doctors who know artificial intelligence, we may replace the doctors who do not know or use artificial intelligence. So knowing this technology is very important. Not that it will replace us, but it is one of the mandatory stuffs what we all have to know. Any comments on that?
Dr. Manohar, actually, I have a different opinion. I personally feel, I look very closely at AI, and I have been working on this since past 8-7 years. All this technology field, and even my son, who is 13-year-old, is a app developer. He's a coder. So we both are working on it, and we share so many thoughts together, and we are working on many projects also. So I just can sense that we would be outdated. We will not be required. And this is a harsh statement, but it is true. We will not be required anymore. Just for one simple reason, because the reason for this is us. And I would like to take 2-3 minutes. I would like to explain this, because what has happened, we have become less empathic to our patient, and we have become less empathic, and that has given rise only to one thing, which is to dissatisfaction. The bond which was there is now not that strong, which was there previously, due to various reasons. Only the doctor is not responsible. There are various reasons. But one component which was making our patient to stick to us was the empathy. When the empathy is gone, and you just see that endocrine software, it is generating results in 20 seconds. Who will wait at you are in my clinic for 1 hour, 2 hours?
True.
At pennies, we will get the prescription, because you are also giving prescription. I am also giving prescription. We are not talking, how are you, uncle? What are you doing? How are you feeling? We have also become a robot-like thing. So this will happen, Manohar, if we will not change. This is the time for us to learn that we need to change. Only the people who will change themselves for empathy towards patient, they will survive. They will survive till the last, because empathy we cannot expect from a machine. Machine will behave in the way machines behave. You see any sci-fi movie, machine behave without emotions. So I don't expect a machine to lose emotions, but we should not lose emotions, which I think many of us, and including me, I feel sometimes we do.
Very well. I mean, Dr. I completely empathize what you have said, because empathy and compassion, these are the two things. And any artificial intelligence or machine learning, they actually do the predictive models. They will say either this or that. They will not be able to reason it out, because they, like, I was actually watching one video, and where the speaker said that, look, if you are a driver of an engine and you are running the train which has got, say, 300 passengers, and you find that on the track there are 5 boys who are playing, and on a side track there is only 1 boy. So you've got 3 options: either you keep on running, all the 5 boys will die, or you go on to the another track where only 1 boy is there, or you apply sudden brakes where the passengers, those who are inside the train, they may get hurt, but they may die, they may not die. So these are the 3 options. If you feed it in the machine learning, it will go to the 1 boy saving, because they will work on the least risk on that philosophy. But if you are actually, you are the driver, you are applying your brain, you will think on all the 3 possible scenarios, and you will also try to explore whether there's another 4th scenario by way of which all these 3 could be avoided. So that is what the machine learning and artificial intelligence, they are not going to do, which human beings can do that. So empathy, as you very rightly said, empathy is something which they will not be able to. 90% they may be able to replace, but 10% component, which comprises of empathy and compassion, which is going to be the distinguishing factor between us and all these machine learnings.
Yeah, they could feed that component also, isn't it? Just to sound empathetic and then be, oh my God, it should not have happened to you, and things like that. Oh, I'm so sorry. You were doing so well. Now you are doing like this. I don't think that is a very difficult thing for the machine to happen.
No, I'm not telling that they cannot do it. I'm telling, if we are able to do it, then only we can compete with machines. They will be empathic one day. One day they will be empathic, but before that we should be empathic so that we should survive. I'm not talking about 50 years down the line. 50 years down the line, no one will take a consultation for diabetes from a human being.
True. That's what I was coming to. I think the advances are so much. Now, you yourself said you don't need a retina specialist in the clinic, isn't it? So instead of 10 retina specialists, maybe 1 is good enough. So we need to look at the population size now. We need population only to utilize services rather than to do the service or this, isn't it? So we need to, it will disrupt in many ways. And I think we need a holistic approach to it. Otherwise, many of us will be standing jobless. Many of us means not just doctors, I'm saying. Every field, every repetitive field, especially almost every field, I think they will require a scaling down of numbers who really need to work and do something different. Any thoughts, Vijay? Because he also used to work a lot in this AI field in diabetology much before anyone else could have started it. So any opinions on that?
Yeah, as you rightly said, Manohar, firstly, I would like to appreciate Dr. Bharat. You elaborated what does artificial intelligence mean. It was like everyone understand the difference between machine learning and artificial intelligence. A lot of things go in the future, and even I foresee, just like you, many things. I mean, I will say it will be we will be controlled by artificial intelligence. Definitely. That is for sure. With the simple reason being, nowadays in the schools also, which is mostly the technology that is being used for even teaching. And the learning is also in technology. And the children are also learning technology. And they are more dependent on technology. And by the time they come up in the future, they are only into technology. And finally, by that time, they know artificial intelligence, they can crack everything. And then most of the times they are only on that. So by the time they see even any doctor, they are already knowing everything. So maybe it is only for the nurse, maybe more survival because she has to give the injection. So physical things. So that's definitely one threat we are going to have. But somewhere down the line, we definitely have some authority. So everything will not be authorized. There are rules that would be going to come in picture. and policies that will definitely going to come into picture, and doctors will be there at least to sign. So without which nothing can go in front. So that's what even my feeling would be. Whatever, now it's only the development stage. Many people, even non-medical professional, would be taking the advantage to, just maybe collect everything and then make it a big until then. But once it becomes big, it is handed over to everyone. Then the policies come in and, a lot of changes. Definitely, they won't allow everything in public hand. So I'm sure that that's there, that point. What do you say, Dr. Bharat?
Yes, sir, it would be definitely there. We need to pump up ourselves. We need to actually be more agile, and we need to look. One way I think we can delay this attrition of ours is by not divulging our data to anyone. This is one
That's
way
right.
we can help ourselves, because we at times give our data too easily to anyone. I mean to say, to any EMR company or to any lab or wherever it is. Because what these lab people do, they once they feed the data of the patient, they know the HbA1c is done. After 3 months, they will send him a message with a discount card. So your patient is gone, or they will know that he's on consultation somewhere. So there's all AI-based softwares are automatically firing the SMSs or all these things. One little small example of how AI is disruptive right now with us. So we should keep our data with ourselves. We should not easily give our data to anyone. And secondly, we need to upgrade ourselves in terms of being more precise in what we are writing, being more ethical, being more guideline driven, and being more empathic. These are the ways we can save ourselves till the last.
Exactly. That's one thing. That's the exact thing I was telling Manohar also from last 5-6 years when he was asking about EMRs. What do you say, Manohar? I've been telling you this is how it is going to happen in the future.
Well, actually, I would say that, always technology is always a blessing in disguise, but sometimes it will also really hamper us a lot. But I always feel that, that the role of the doctors will never go. Maybe this technology can really help a doctor in treating the patients better, preventing the things better. That's what I always feel that. We have seen a lot of cases where a lot of patients who have the data, unfortunately, they cannot, correlate and put it into together. So where the doctor's role is also there. I don't deny that, for another 20, 30 years, a doctor role might really not come down. Technology can help out, but it will definitely be there, is what I feel.
Yeah, here two things. I don't think we should be very scared of technology or whatever. How are we going to see ourselves in the future? What precautions, measures do we need to do it? Right from, for example, the number of medical seats going up and up and up. Talking about not able to reach the rural area. Let's say, like the technology has reached the rural area. Doctors might not have reached yet. So with that also barrier to a large extent can come down, at least for certain, most of the repetitive disease. We all do repetitive practice, isn't it? We have seen 100 patients. I think 70, 80 patients, we have done the same things most of the time. I mean, slightly different, but yeah, most of the time it is the same. So in that context, what adjustments do we need to make for ourselves? And what do we tell our future generations is also very important, not just to know about what artificial intelligence. And one more person, Dr. Haim has joined. I don't know if he's on the screen. Haim also has done a lot of work on artificial intelligence. And I saw the real intelligent Dr. Shekhar. I don't know, he left again, I think. I think we can ask him to rejoin. Hey, your comments on this?
Yeah, so empathy. So I just finished a review of one of the book about artificial intelligence, Clara and the Sun. I think Dr. Saboo might have heard or read about that book. One of the Nobel winning authors' book, that is Clara and the Sun. It is a novel about artificial friend in the future for the children who are lifted. Lifted means they are genetically modified to be, and these are robots which are produced to become friends or a companion to the to these lifted babies. So a very emotionally touching novels. It is like the other way around. We are not empathetic. We are losing the empathy nowadays. And here the artificial friend is gaining empathy. This is a fiction, but what is going to happen, we don't know. Dr. Saboo has given excellent, very focused and very structured presentation on this. Probably as expected from an IITian, probably more than a doctor. One thing is in the artificial intelligence, the problem is going to be with who is going to consume this artificial intelligence. So if we are not going to be guided by a human, how are we going to consume this artificial intelligence? So the very common comment we give is, you torture data and statistics enough, it will tell you what you want to. The same thing is going to happen. Big corporations who own the servers and who control the artificial intelligence are going to manipulate data, manipulate the guidelines, manipulate the what we consume. So this is a big threat. I don't think in another 5, 10, 20 years, I don't think artificial intelligence will be allowed to do anything significant on its own. There is no artificial intelligence doctor probably in our practice time. In rural areas, yes, it's going to help the doctors take decisions and analyze the data. All those things are going to happen. 5 years, I don't think 10 years, 15 years. In 5 years time, probably our phones or our we might have a consoles which are artificial intelligence driven, which gives us guidelines. When we write medications, it tells us interactions, it tells us what to give, what not to give, suggestions. Already it's happening. Already many
Yes,
EMRs,
yes.
this thing, the suggestions are happening based on AI only. These things are happening. Chatbots are there all over. IRCTC, the one of the Indian government company, is using a chatbot, AI-powered chatbot to suggest you trains. So this is very exciting. I will say that as Mr. Pankaj has told, we have to survive only if we learn artificial intelligence. We have to survive against artificial intelligence. That is more important. So we have to survive against this, and we will survive. Human race has survived against many other things. We also will survive. Only problem is, as Dr. Manohar told, for the future doctors, somebody who is going to graduate 5, 10 years later, what is there in store for them is a big question. So I don't think they have a. There will be doctors who are super intelligent, who can actually devise the guidelines, and there are doctors who are to the base, who will sit with the patient, discuss with them, and help them pick up a guideline, pick up a treatment which is suggested by AI. Only 2 levels will be there, and the doctors who are mediocre, in between, middle path, they will be extinct for a period of 10, 15 years. But again, Dr. Saboo, I think you should be knowing that once the data dries up, the artificial intelligence will become redundant. It won't be much useful. So who is going to generate the data?
That is what I was
So,
saying. We can linger it on for data.
Yes. So that is where we have the key. Fortunately, we have less data in India as of now. So probably, like as we have been protected from 2008 meltdown, financial meltdown, from artificial intelligence proven meltdown, also probably we will be protected for another 15, 20 years just because we didn't generate enough data.
Sometimes
that's what I feel.
Ignorance is a bliss, sir. I believe this.
So please read that Clara and the Sun, a very touching novel, which gives a perspective on how it's going to be in the future. It may not be exactly, but something which is very a different angle of seeing the things. I'm very interested in artificial intelligence. I'm very excited to see what and all it can do in the future. I think we should all enjoy this journey. Probably another 5, 10 years is going to be very exciting for all of us.
Great. Dr. Bharat, there's a question by Dr. J.P. Mishra. Opinion about non-invasive CGMS.
It's very much on the way. It's coming. It's in various names. Google is working on a Google Lens. Apple is having a code name E5 for it. They are working since past 12 years. They were willing to incorporate in the next Apple Watch 9, but now I guess they will incorporate in the third Ultra watch, as far as I know. It would be 1 more year before we have the second and then the third Apple Watch Ultra. It is there. They are working on it. They have been successful to read the data. I met one person, Bruno Thuler. He is a CEO of Body Sense. He's doing something exceptionally different, which I don't know you people know it or not. He's doing a breath analyzer sort of non-invasive glucose monitoring. This is something revolutionary. You will have a whistle, you will just whistle in it and you will know your blood sugar value. So the scope is wide and open. All are successful in generating glucose values out of it. They are just validating it. And the sooner anyone will validate, they will come. I think the first would be Apple to come. Let's bet on this. I don't know.
Yes, thank you. It was an interesting session, Dr. Bharat. Clearly elaborated about the artificial intelligence. Now it's looked more like what the future we have with this artificial intelligence. Let's not forget our present intelligence, so that we don't linger upon thinking about the future. Let's, like you rightly said, we should have that empathy towards the patients. That's what will take us a long way. With this, I thank you for giving your time to give a wonderful session here with the KRSSDI, and KRSSD will be thankful. And if opportunity applies, we'll be definitely pulling you out again. Thank you for that. And thank you, Dr. Pankaj, for moderating this in a wonderful way. And as usual, you have been very active in our sessions. Thank you, Dr. Thank you, Pankaj. And we all thank all the delegates who have logged in, and also those who are watching it live. And hope these sessions will be very useful to you. Thank you very much.